Hello, I'm Julie Oglesby, registered nurse and orthopedic coordinator at Spartanburg Regional Healthcare System. Thank you for choosing Spartanburg Regional Healthcare System for your joint replacement surgery. Our team of experts are here to help you receive the best medical treatment available and to make your stay as comfortable as possible. This video, Preparing for Surgery, is the first in a 3-part series that will walk you through every step of your joint replacement journey, including how to prepare, what to expect, and what to do to ensure the best possible recovery. Spartanburg Regional's Joint Camp is a collaborative effort that starts with you and includes your orthopedic surgeon, orthopedic coordinator, hospital staff, your care partner, and home health services. The Total Joint class was developed especially for you to ensure that you have all the tools you need before, during, and after surgery. The information presented in this video series can also be found in our Total Joint Replacement Patient Guide. This important guide serves as a comprehensive resource of information for you from the beginning of your joint replacement journey and beyond. In this video, you will learn what an important role you play in your own total joint journey. We will review the 4 phases of surgery, as well as what to do in the weeks and days before surgery in order to be as prepared as possible. We will also discuss how important pre-surgery preparation is to your post-surgery recovery in a program known as ERAS and Prehabilitation. There are 4 phases in your joint replacement journey. In each phase, there are a variety of important things to know and do. The preparation phase begins when your surgery is scheduled. You will move into the preoperative phase a few days before your surgery. When you arrive at the hospital, you begin the perioperative phase, and the post-surgical recovery phase begins after your surgery is complete. This video is part 1 in a 3-part series designed to guide you through the 4 phases of your total joint replacement. In this presentation, we will familiarize you with the first 2 phases, the preparation phase and the preoperative phase. It goes without saying that you are the star of this show. We want you to be as knowledgeable and prepared as possible so you feel confident and comfortable about each step of the process. If you've not already done so, now is the time to identify a care partner. A care partner is a family member or a friend you can count on to be with you through the entire process of your total joint replacement. It should be someone who can commit to help with transportation to and from the hospital, as well as to your physician and therapy appointments. They should also be prepared to help with meal preparation and activities of daily living. Phase 1 of your total joint replacement journey is called the preparation phase, and it begins several weeks before your surgery date. To prepare, let the appropriate people know about your upcoming surgery. If you are employed, notify your employer to arrange for time off. Also, contact your insurance company to confirm how much of the cost they will cover and set up a payment plan with the hospital for your portion of the bill. Plan ahead and schedule any necessary appointments that need to be completed before your surgery. Include medical and dental appointments, but don't forget about routine items like getting a haircut or taking the dog to the groomer. If you haven't already done so, this is the perfect time to set up advanced directives for healthcare. Advanced directives is a general term that applies to 2 basic types of legal documents, a living will and a medical power of attorney. Creating a living will to communicate your healthcare wishes for the future is a gift to both you and those you love. A medical POA, or power of attorney, involves designating someone to make healthcare decisions on your behalf if for any reason you are not able to. Blank copies of these documents can be located on the Spartanburg Regional Healthcare System website at spartanburgregional.com. We also have an advanced care planning department to help you if you have any questions or want additional information. You will need to bring a copy of your advanced directives to your pre-admission testing appointment. It is important to prepare your home so you have a safe environment after surgery. Remove all throw rugs. Pathways should be well lit and free of cords and trip hazards. If necessary, install handrails. You will need a chair with arms to assist with easing yourself into standing position. In the kitchen, place frequently used items at waist level for easy access. In the bathroom, some patients prefer a higher toilet during the recovery period. If possible, establish a bed and bathroom you can use on the main level of your home. If you have pets, you should refrain from letting them sleep in the bed until the surgical incision is healed. Don't allow pets to jump on you, as this can lead to falls. You will need someone to help with laundry the first few weeks after surgery. Nutrition is very important for healing, so plan ahead for hearty, nutritious meals. You can pre-cook and freeze food, schedule food delivery services, or ask friends and family for help with meals after surgery. Enhanced Recovery After Surgery, or ERAS, is a modern treatment program for surgical patients that is based on the best available medical science. Enhanced recovery, sometimes referred to as rapid or accelerated recovery, and some aspects of ERAS care may be different from any previous operations you may have had. One key component of enhanced recovery is to ensure that patients are as healthy and prepared as possible before receiving treatment. Having an operation can be both physically and emotionally stressful. Enhanced recovery programs encompass guidelines for the best patient care before, during, and after your surgery, and are designed to reduce stress and help you return to an active lifestyle as soon as possible. One part of the ERAS program is to optimize nutrition to help your body heal. This should begin in the preparation phase and continue through the entire joint replacement process. Protein is a key nutrient for muscle and bone building. It also benefits the immune system. The amino acids in protein assist with wound healing and tissue regeneration, as well as helping with strength and energy following surgery. Eating protein-rich food is the best way to increase protein levels, but nutrition supplements can help as well. Protein needs are unique to each individual, but as a general rule, the body needs 1.5 grams of protein for every kilogram of body weight post-surgery. Constipation can be an unwanted side effect of any surgery, so increasing fiber and water intake starting now is beneficial. The American Heart Association recommends getting 25 to 30 grams of fiber each day by eating a variety of foods. This includes fruits, beans, and vegetables, as well as whole wheat varieties of bread, cereal, and pasta. Fiber needs water to do its job, so as you increase your fiber intake, it is also important to increase fluids. To ensure you're drinking enough water, set daily goals, keep a stockpile of water bottles handy for when you're on the go, and get into the habit of drinking a glass of water before each meal, when you wake up, and before you go to bed. Hydrating is also important, especially after surgery. Water increases blood flow to the incision site and can help prevent the formation of blood clots. Adding protein and water to your diet is an important part of preparing for enhanced recovery, but eliminating unhealthy habits are just as important. Research has shown that diets high in sugar and saturated fat can increase inflammation. We want the opposite when healing from surgery, so it is important to start limiting consumption of sugary foods and beverages, caffeine, and alcohol now. One of the best ways to ensure proper nutrition after surgery is to prepare and freeze healthy meals in advance. This will make post-surgery meals easy and convenient and give your healing body the benefit of proper nutrition. If you've been waiting for the right time to quit smoking, this is it. You probably already know that smoking is bad for your overall health, but it can complicate surgery as well. Smokers typically require higher doses of anesthesia, take longer to heal, and have a higher risk for heart attack after surgery than non-smokers. The South Carolina Quit for Keeps program has helped millions of people, and it can help you too. Get started today and connect for one-on-one support to beat urges, manage withdrawal, and switch up your habits so you can enjoy tobacco-free life. It takes a couple of weeks for your lungs and immune system to start to function properly after you quit smoking, so the sooner you quit, the better. Most people have heard of doing physical therapy after surgery for rehabilitation, but not everyone is familiar with the concept of prehabilitation. Prehabilitation involves exercising before surgery to make you stronger so there is less weakness to correct after surgery. Prehabilitation exercises have been proven to help patients feel stronger and better prepared for surgery and recovery. It is understandable that your activity level and strength may have decreased over time due to joint pain and mobility issues, but remind yourself that the stronger you are before surgery, the easier recovery will be after surgery. Do your best to be as active as you can between now and your surgery date by walking, sitting up instead of lying down, and doing the recommended exercises found in the Total Joint Replacement Patient Guide. Phase 2 is the preoperative phase, and it begins a few days before your surgery. Beginning the preoperative phase is your pre-admission testing appointment, which will be scheduled by your surgeon's office. At this appointment, you will meet with a registered nurse who will gather information about your health history, as well as any medications or supplements you are taking. If additional lab work is needed, it will be performed at this time. The nurse will also review any paperwork or test results. They will provide important instructions for you to follow in the days leading up to surgery. The items and instructions you receive at your pre-admission testing appointment are important parts of the ERAS program. You will start using several items to help prevent infection 2 days before your surgery. CHG bath wipes are used each night after bathing. Paradex is an oral mouth rinse that helps to eliminate bacteria, and mupirocin ointment is applied inside both nostrils to help eliminate bacteria as well. Depending on your doctor, you may receive 3 pre-surgery nutrition drinks. You will drink 2 of these the night before surgery and 1 the next morning before coming into the hospital. As your surgery date gets closer, be sure to monitor your health and call us if you get sick. There are several conditions that can delay surgery, so it's important for us to know if you're having any issues. Some prescription drugs and supplements need to be discontinued several days before surgery. Make sure to discuss this with your surgeon in advance. As you pack your bag for your hospital stay, please remember to leave all valuable items at home. Some items that you will want to pack include your medication list. Please include dosage and how often you take them. Do not bring your medicine bottles. Books, magazines, or other reading materials. Your glasses, dentures, hearing aids, and their cases, walking shoes or sneakers with non-skid soles, copies of your power of attorney or advance directives, loose-fitting clothes if you do not wish to wear a hospital gown, personal toiletries if desired, and your Total Joint Replacement Patient Guide. The day before your surgery, do not eat any solid food after midnight and do not shave the area on your body where your surgery will take place. This will be done by the surgical staff if necessary. Please do make sure you have removed all jewelry, body piercings, and nail polish. Also, if ordered by your doctor, drink 2 pre-surgery nutrition drinks the night before surgery and 1 the next morning before coming to the hospital. Do brush your teeth on the morning of your surgery. Most importantly, we want you to take a deep breath, try to relax, and rest assured that our team of experts are committed to giving you the best medical treatment available and to making your hospital stay and recovery as comfortable as possible.